Historically, CRDR has been involved in development of TB treatment regimens. Initially, TB treatment used to take over a year, and then CRDR was involved in trials that reduced it to 9 months. And again, got involved with the additional studies that reduced it to 6 months. And recently, we've been involved in trials that also target to reduce TB treatment to 4 months. So we are at the forefront of TB control and TB treatment.
The East Africa Public Health Laboratory Networking Project was established in 2010 when heads of the 5 East African states, namely Uganda, Kenya, Tanzania, Rwanda, and Burundi, met in Arusha and established this public health laboratory networking project, whose main aim was or is to establish a high quality, efficient, and easy to assess laboratories in the region, so that to facilitate the diagnosis of mainly tuberculosis and other communicable diseases. We were looking at evaluating the new tools, new technologies, molecular tools, looking at how they perform. And we found that they perform equally in all countries, and they can also be adopted at any site, at any facility in the country, because they have high reproducibility. Reproducibility is when a tool is done by, results are produced by one person, and they can be reproduced by another person independently or another site independently. And this we have documented. And this is the first time, actually, for people for in the world, if I can say, to indicate, to observe, to document that this tool, that is a molecular technology tool, that is Gene Expert, can be replicated wherever it is put.
Gene Expert is a machine that I used to detect MTB, that is Mycobacterium tuberculosis. That is, in short, it is a TB detection machine. And this machine, it is very important because it isolates the reef resistance. Reef resistance, I mean, is a drug that is sensitive to medication of TB. So, for instance, if we use the machine, it will show us that this rifampicin is reacting with the oral. Is it treating or not? So the machine will remove the result whereby it shows MTP detected or MTP not detected. For MTP detected, it means we have TB. For MTP not detected, it means the patient has no TB.
During this particular period, we managed to run several samples with the Gene Expert, and the results that we got were very impressive, and these results led to inform the policymakers to come up with a new series of the Gene Expert, the Omni Gene Expert.
The experiences, challenges, and lessons learned that the staff at the facility were able to highlight, we were so impressed by how they were able to handle them, because we wanted them to be able to identify these challenges and develop solutions that were homegrown. And that is how, therefore, they were able to implement research, even going forward, even at the end of this project, that there was going to be continuability and sustainability of conducting research, even when the mentorship process is over.
We have produced manuscripts totaling to 19 manuscripts within the span of 5-6 years of this project. I believe, I think in KEMRI, because already even we have discussed with our other colleagues, no one single project has ever produced 20 manuscripts in one project. I think this is a big achievement, and because of this, KEMRI, the secretariat with my team, we were awarded a certificate at a regional meeting, steering committee meeting by the EAPHL group